Hi friends, at the outset let me thank my friend Vasundhara Raghavan for giving me this opportunity to address you all. I'm the chairman of Mumbai Kidney Foundation, secretary of Amar Gandhi Foundation, and trustee of Corep Trust of Dr. Vidya Acharya, my teacher, and trustee of Sapiens Health Foundation of Dr. Ravi Chandran. So you might be noticing I must be hardly working. I'm only working for the NGOs, but that's my passion. And of course, I'm a nephrologist. So today my job is to take a small talk on the training and teaching of dialysis technicians as it is in India, and as Mumbai Kidney Foundation's education group has planned to do whatever best we can as an NGO for the dialysis technicians in India. As you all know, dialysis technician is the main pillar of any dialysis unit. It's the face of it. It's the frontline person whom the dialysis patient meets. And quite often, he is the only person which sometimes they meet. The nephrologists may come not daily, but intermittently, although the nephrologist is in the know-how of what is happening about the patients. But it's the dialysis technician on whom the reputation of the dialysis unit depends. And hence, it's vitally important that the dialysis technician is not only knowledgeable, skilled, but also good in what we call as soft skills. So like a nephrologist, he should be good in the art as well as the science of giving dialysis to the patients. He is the main interface between the nephrologist and the patient. We have roughly about 1.2 to 1.5 lakhs patients who are taking dialysis. We have roughly around 6,000 dialysis centers, around 30,000 dialysis machines, and maybe we do about 12 to 14 lakhs dialysis sessions in a month. This is, of course, a little statistics from industry. It may not be accurate, but a little bit here and there. And to service all this, we have about 10 to 12,000 dialysis technicians. Although these dialysis technicians are spread out all around, throughout the country, but as nephrology services and similarly the dialysis technicians, they're a little more concentrated in the south and west, a little less. Now, of course, north and east also have the same. Maybe around 50% of the dialysis technicians who are relatively senior did not have the required degree, as many of the even nephrologists who are very senior did not have DM or DNB degree, but by training, and I'm aware of how many I have trained during the times when I started my practice, which is about, say, 30, 35 years old. They were not the degree holders. But today we have in our country a proper training program by many universities, hospitals, and some of the dialysis chains. And this is divided into almost three parts, if you try and understand. A 12 plus 3 years degree course, which could be a BSc in dialysis technology, renal dialysis technicians, or dialysis therapy. These are the BSc courses, which are there attached to a lot of universities. And similarly, we have dialysis diploma in dialysis technology, dialysis technicians, and dialysis therapy. This is about 2 years course. And we have a certificate course, which is generally 1 year, and in some places 2 years. Again, there are, as I said, many places from where they can get these courses. So we do have a lot of such training institutes. These are the certified courses which are available. Most of them are 12 plus 3. Some of them are 10 plus 3, which is more of a certificate, diploma, and degree. The general syllabus is in the form of classroom training, hands-on in the dialysis centers, and of course, a small internship. The classroom or the initial part is predominantly a theory part on the machines, the procedures, the assessment of patient, the monitoring of patient, how to disinfect the machines, how to look into the sterility of the center, the clinical part of the patient, how to handle emergencies. Then they are taught the reprocessing of dialysis machines, the maintenance of RO, record keeping, protocol formation, and how to improve the quality of life. But ultimately, we are treating patients. Who is the center of all this? So the wellness of the patient should be the center of this teaching and training of the dialysis technicians. And therefore, a lot of importance should be given to teach the soft skills, how to get teamwork done by the technicians. And most important word, which is empathy. And this empathy is important because there are issues with the dialysis patients which go beyond just renal failure. There are financial issues, social issues, issues of transportation, arranging caregivers, and so on. Contrast to that, there are also issues with the dialysis technician. They have their own problems. They have, most of them come from lower socioeconomic background. They have issues with their family, social, financial, children, and so on. So each one has to understand the issues of the other, and that is how we bring harmony. In fact, my next Zoom meeting is on that. We are having technicians, we are having patients, and a panel is there. We are having a nephrologist and a center manager who manages all this and trying to understand each other's program. Now, so much for what is existing in India. But more importantly, what we are doing as Mumbai Kidney Foundation, we formed a Mumbai Kidney Foundation education group. And this education group comprises of 5 chapters. The northern chapter, comprising of the nephrologists, some of them from the north, who are actively interested in teaching, like Dr. Vijay K, Rajay K, Raja Ramchandran, etc. They form the northern chapter. We have in the eastern chapter, we have western chapter, southern chapter, and a central India chapter. So we have 5 different zones in which these Mumbai Kidney Foundation education group nephrologists are active. We formed a module of teaching which comprises of 3 parts. One is the Zoom meeting every month on certain little more complicated topics. The second one is making 5 to 8 minutes small videos on various topics, and they are loaded on the WhatsApp group, because WhatsApp is somehow in our country the commonest methodology of imparting various news. So WhatsApp is actually social media ka one of the better methods if you want to have small videos to be imparted. So we give from time to time, maybe twice or thrice a week, we load small videos made by different nephrologists from the country, and they train the people in different aspects of dialysis. So it's a kind of a refresher course for people who are already trained. This is not a training institute. It's just a refresher course to make them revise what they already know, and there is some extra new items which is added to it. We also have Ask Your Nephrologist area, which is basically, if they have any queries, the technicians can ask us. The other advantage, because it's WhatsApp, there's no compulsion. They want, they can see. They can see it at length, at their own leisure. They want to see it now, later on, etc. It's also loaded on the YouTube, and they can go and check it. The Zoom meeting is also Facebook Live. So, and of course, it's completely free. So they have their own time. They can see whatever they have missed. If they can't see it real time when the Zoom meeting is going on, they can later on. Now, we are also thinking of expanding these services in the sense that we want to do a little advanced course also, which is kind of those technicians who have aspirations to go beyond the average technician. For them, we are the Mumbai Kidney Foundation Education Group is planning to have a little advanced course in which certain specific areas which are not covered in this or the critical care area or the ICU area, etc., will be covered. So friends, this is how Mumbai Kidney Foundation has started the dialysis technician education course, and you won't believe we have 30 WhatsApp groups totaling around 4,000 to 5,000 dialysis technicians in the country. And we are kind of sending these small videos to them. The feedback is excellent. Most people are extremely happy, and they want us to continue the whole thing. And we should not forget that at the center of all this is the patient. And therefore, as Vasundhara is doing, as we are also trying to do, the patient issues are also brought in front of the dialysis technicians, and the dialysis technicians issues are also brought in front of the patients. And together we build a symphony where the patient care will be foremost. For now, this is what I wanted to talk about, the plan of dialysis education for the technician, what already exists, what is going on with the Mumbai Kidney Foundation. And I hope if there are any questions, we could handle later on. Thank you so much.